Hello, today my name is Sushma Gokhale, and today we are going to talk about flu shots and pregnancy in particular. Today, flu shots are recommended during all trimesters of pregnancy. It didn't used to be the case when I was pregnant. At that time, doctors told me flu shots are to be specifically avoided. All vaccinations, as a matter of fact, are to be avoided in pregnancy. Then they started recommending flu shots in the last trimester of pregnancy. Then they started recommending them in the second trimester of pregnancy, and now they recommend them as early as the first trimester of pregnancy. And so the question we have to ask ourselves is, what is a flu shot? How useful is the flu shot? Does it protect the mother? Does it protect the infant, the fetus? And the science, the actual facts are that no studies have adequately assessed the risk of this vaccination during pregnancy. There is no animal testing data. There is thimerosal, a mercury-based preservative, which is present, used as a preservative in most multidose flu vaccines. It has about 50% mercury, about 25 micrograms of mercury. And this is responsible for a number of human neurodevelopment disorders. That means your fetus, which is yay big, about, in the first trimester, maybe it's the size of an egg or more, double the size of an egg, is being subjected or exposed to this thimerosal. Thimerosal or mercury crosses the blood placenta membrane at 6x, 4 to 6x times, and concentrates in the fetus. So the fetus is very small, and it is greater than 250 times the EPA hazardous dose for thimerosal if administered to a fetus that small. And so there's a lot of things related to the influenza vaccine that are very, very troubling. They are previous influenza vaccines used to be advised only for women with pre-existing medical conditions or women who were at risk. They were not recommended endorsed for everybody. They're available in two forms. One is the inactivated, live attenuated, and the viruses for both vaccines are grown in embryonated hen's eggs, which is chicken DNA. And therefore they contain egg protein. And you find that a lot of children are severely allergic. They get anaphylactic shock from consuming eggs. So clinicians should take particular care not to administer this vaccine to women who are allergic to eggs, because an inflammatory reaction during pregnancy is very risky for the mom. So the inactivated vaccine is available in two forms. The first is a purified surface antigen preparation, and the second is a split virus type vaccine. That's obtained by disrupting the virus using a non-ionic surfactant. So many methods are used to inactivate these viruses, and antibiotics are added to secure the sterility. So the way the viruses are destroyed is by toxic means. Some of those toxins get retained. Not all of those can be taken out of the solution. The split virus vaccine is further purified chemically, and then it's suspended in sodium phosphate buffered isotonic sodium chloride solutions. And so this, folks, is injected into the mom's body. David Ayub has done some very good research on the influenza vaccines that were available in the United States over the years, and exactly how they have worked out for the population.